don't bother frantically taking notes. Just sit back and listen to the information that we're going to share tonight. Okay. So here's how we're going to conduct the next hour to hour and a half. We're going through our welcome, then we're going to hear from our clinic team. The clinic has been in existence since 2004 to the present, and we have a lot of new faces and names and some really familiar names and faces. And we have some new services, and we've had some changes based on the very unusual year. So I know everyone is anxious to hear about all the happenings at Katie's clinic. Tonight, because we are being hosted by the International Rett Syndrome Foundation, we're going to focus primarily on Rett syndrome, but we are Rett and related disorders program. And so the clinicians are going to talk as well to our families that have joined us from CDKL5, FOXG1, MSPT duplication, and we're so glad that you're here with us. After we talk about the happenings at clinic, I'm going to give some updates from the International Rett Syndrome Foundation, and then we'll go to QA. Okay. So I have to give a special shout out and a thank you to Acadia Pharmaceuticals, Novartis, and Taysha Gene Therapies, who have given us educational grants to be able to bring things like town halls, as well as Rett Eds and all educational programming to our community. We couldn't do that without them, as well as all of you who make donations and contributions to IRSF privately or through events. So thanks to our sponsors. Now, I know that tonight we have a lot of newly diagnosed families, as well as families that have been on their journey for a while. We have families that have never visited clinic before, and we have some frequent flyers at clinic. So what I wanted to do was really open with this quote, which resonated with me, that a newly diagnosed family had written. And I think it speaks to the spirit and the essence of our clinic, right? We're all very anxious to have research progress. Progress is being made, but this is really what I think as parents we need to ground ourselves in. So I'm going to read this. I know you're all capable of reading it yourself, but let me read this quote. Today marks 2 years since we found out our daughter A has Rett. Before she was diagnosed, I worried, why can't she do this? When we got the diagnosis, it was, she won't be able to do this. And now I focus on figuring out, how can she do this? I'm so proud of her for all that she has and continues to accomplish. While I still have moments of sadness and worry about what the future will bring, I'm trying to ground myself in the present because it's a good place to be. Now, I just want to say that I think that this quote not only is a very positive way of being as a parent, it also really embodies the belief system of everybody at Katie's clinic who genuinely enjoy their time with you, with your families, and helping you figure out everything that your child can accomplish, because they really believe in the progression of skills, not in the loss of skills. So anyway, thanks for giving me a minute to share that quote. And now I'd like to stop talking, and I would like to turn over some time to Katie Hale, who's the nurse practitioner at Katie's clinic, to start us off with our town hall with a special tribute to one of the wonderful members of our clinic, Dr. Mary Jones. All right, so Katie, take it away.
Hi, everyone. First, just thanks to everybody for joining us on Thursday night. You know, we just couldn't begin this presentation without a tribute to Dr. Mary Jones, who most of you know, and you know, Dr. Mary passed away this November. She was the medical director of Katie's clinic for many years, and Mary just went above and beyond for our families, for our team. She's really always going to be in our hearts, and she's always going to be a part of this clinic, sort of no matter what. And we're just lucky to have known her. And I know our team feels very lucky to have been trained by her. I love this picture of Dr. Mary and I taking care of one of our patients, because that smile on Dr. Mary's face is just what I will always remember, just the pure joy and love and dedication to our families. It was just, she was so special. So we're so grateful for her. And I just know that she would be thrilled knowing that we're continuing. And that was so important to her. And so on that note, I just want to introduce our new medical director, Dr. Jennifer, Martelle Tu. She's a pediatric neurologist, and she's just been a wonderful addition to our team and a huge, huge advocate for our clinic continuing. So I just want to pass it off to Dr. Tu.
Well, hello, everyone. We're so excited that you could all join us, and we're so excited to share a bit about what we've been working on and how we're really trying to get clinic up and running through COVID. Despite all the odds, we're still going, but we're very happy to share and very glad that you guys are here with us tonight. I just want to take an opportunity to introduce the team kind of as a whole, and then each person on our team will kind of present what their role is and how they will help your child or your patient or you, your family during their visit, okay? So I'm, like Katie said, I'm the medical director. So I'm a general neurologist, and my role is to see sort of the neurology needs and oversee how the clinic runs. We have a wonderful physical therapist, Marybeth Finch. She's got a lot of experience working with Rett syndrome, as well as Paige mentioned, are associated in similar conditions. So she's got a lot of experience. She's great at what she does, a lot of energy. We have Judy Lariviere, who's our, she's occupational therapist, but she does our augmentative and assistive alternative communication. She's fantastic. She has a lot of experience in this field and really can help take your child's communication just above and beyond. She's great at what she does, very enthusiastic. Diane Matlock down below, she is our administrator for the clinic. She's sort of in charge of making sure you get to come to clinic. She gets all the necessary paperwork, all the authorizations, another great contributor to the clinic. You guys have met Katie briefly, and some of you know her from past experience and past clinic visits. She's a nurse practitioner for our clinic. She has the general overview for patients and really sees the whole picture and helps kind of advocate for your child as a whole. And then we've got Susan Bessler, who's our dietitian, really looks out for the growth for your child, making sure they're getting all the nutrition they need, and really has a lot of experience in general, helping children grow to their potential. So that's our team. Our clinic in general is a Rett syndrome and related disorders clinic. We're going to focus primarily on Rett syndrome tonight. This is an International Rett Syndrome Foundation sponsored town hall, so that's primarily what we're going to focus on tonight. But we don't forget about all the other patients that we see as well: MSPT duplication, FOXG1, CDKL5, all very important syndromes, and all have a lot of overlap with Rett syndrome. So we see all comers, we see all ages. That's an important thing, is you don't age out of our clinic. There's always something that we can help with, and we're happy to see all comers. The things that we generally do during a visit, broad overview here. Of course, we're going to discuss the genetics. You know, that's what brings you to the clinic. These are unique syndromes that are caused by specific genetic mutations and changes, and we'll talk about that during the visit and the implications of that. We'll talk about what to expect. What are the common things that we see? We know that every child is unique. Every patient is unique. No two patients are the same, but there are some common features and things to expect. So we'll talk about sort of expectations there. And then because of the setup of our team and the team members we have, you're going to see neurology, you're going to have communication, physical therapy. We'll talk about growth with a dietitian, and then the broad overview. That's what Katie's role is really looking at all the general health pieces that are associated with these conditions. So you're going to get a very broad overview and a really detailed look at your child and their health. We also are very interested in research, and I think those of you that are active with IRSF know that it's a very, very important goal. So we'll help you talk about clinical trials and research and all the up and coming exciting things that are happening in the Rett community. We want to be a part of that, and we want to help you navigate, because sometimes it's hard to know what's out there and what's available. And we're here to kind of have those conversations as well. And then importantly, coming to see us is just one small piece. You then have to go out to live your life. You have to go back out to the community and go back out to your homes. And, some of you live close by, and that's great. Other of you, you have home institutions and medical centers that are closer to home. And our job is to communicate with your primary care team, with the therapist in your home, all the people that you see close to home. We're going to help communicate the recommendations from our assessments that we do in clinic. And we try and help, make recommendations for any devices or medical equipment or referrals for other evaluations with other specialists that might make your life easier and might bring more quality to your life. So our job is not just to do the evaluation, but it's after. We do a lot of the legwork and making sure that you're getting to see the people that your child needs to see in order to have the best health and really maximize potential. So a little more specifically about my role in the clinic. As I mentioned, I'm the medical director, so I do oversee a lot of just the general care and the practice of what happens in our clinic, kind of keeping things afloat and making sure things run smoothly. But I'm also a general neurologist. So from my perspective, the way I approach your child is going to be different than everyone else on the team, because I'm looking for some specific things, because we know these conditions have specific complications or associated symptoms and features that we need to look out for. So in my assessment, I'm looking at your child's development. What skills are they doing? If they've lost skills, have they finished with that regression? Are they moving forward again? Is this therapy helping to gain more skills? So we'll do a big development assessment. I'm going to look at your child's tone and motor control. We're going to look out for things like seizures. Sometimes it's hard to tell if a movement is just a typical stereotypy, meaning it's repetitive and it's not driven from brain electrical activity, but it's really hard to tell sometimes. So we'll do a good assessment trying to discover if we should do more testing looking for seizures. And then of course, we're going to look at movements in general, because movements that are hard to control sometimes can really impact a child's quality and their ability to use devices and medical equipment. So we'll look at all the movements. And then of course, communication. I'm certainly not the specialist in this area, but it is part of our general approach from neurology. So we'll talk about that as well. From the neurology perspective, if we identify needs during that evaluation, we might refer you for more testing, or maybe you need an EEG or a brain MRI would be helpful. Things like that are something that would come from the referrals or recommendations from my assessment. And then more in the medical director role, I really get that whole patient overview from the rest of the team members. And so my job is to make sure that after the visit, you get all of the referrals you need, prescriptions you need, subspecialty referrals, other testing, not just in the neurology purview, but I want to make sure that your child gets all of the testing, all of the referrals that they need. And so I kind of help in that area, being the medical director. All right, that's it.
Hi, everyone, back to me. So again, I'm Katie, the nurse practitioner. As Jenn sort of described, I sort of define myself as sort of a Rett generalist. I sort of understand how the syndromes affect all the body systems. And at our appointments, I really do sort of a head to toe discussing sort of all of the systems and what's going on, sort of including a head to toe thorough exam. I have, my background is in primary care, so I'm really sort of trained to do a head to toe, and it's very helpful with our patients. And so not only do I then, catch and discuss sort of common issues that are related to the syndromes that we deal with, but also, you know, common medical issues come up too. And I'm obviously more than happy to talk about that, even if it isn't Rett specific or one of our other disorders specific. So, and, you know, at the end of during the visit, you know, I discuss my assessment and recommended treatments. And then I also, you know, provide a report that is really helpful, not only for the family, but also is helpful in communicating my thoughts and my recommendations to the outside care team, the outside providers. And often after visits, I also, you know, communicate with those providers who, you know, often just don't have the expertise in these syndromes, and we really work to sort of guide them. So that's a really a great part of my job. And I will pass it on to Marybeth, our physical therapist.
Oh my goodness. Can you hear me? Hello. Can everybody hear me? Yeah. I wish I could see all your faces because I feel like I probably would know a lot of you and have been lucky enough to work with your children over the last, I can't believe it's been 16 years, but I've been lucky enough to be part of the clinic since its inception. So again, I'm Marybeth Finch, the physical therapist. Sorry, I lost you for a moment. And I was asked to speak about my role in the clinic. And what I'm always thinking is quality of life. How can I support the quality of life of your child? And so we go about that in a few different ways. So first, I really want to think about physical comfort for your child. I'm thinking, does she have the range of motion needed to sit comfortably? Can she stand in her stander or walk without her heels hurting or her calves hurting and feeling too tight? I'm always thinking about positioning is, you know, when she's sitting somewhere, is she feeling comfortable and stable? Does she feel like she's going to slide off the chair and therefore can't focus on other things? I'm also looking at access. So I think quality of life includes access to your environment, especially your social environment. So does your child have the opportunities to move about as easily and efficiently as she can? Can he or she explore as freely as possible, which also requires the stability needed to feel calm enough and secure enough to go ahead and explore? And then access also involves safety. So we're thinking about, that's why I asked so many questions about equipment. Is your child able to join the family at the table? Do they have a seating system in the living room that they're able to relax in? And of course, are they safe in the bath or in the car? So another part of the quality of life that I'm looking at is their motor progression. And I didn't put that first for a reason, because I do believe the other issues are equally or if not more important. But of course, all of us want to see motor progression for these kids. And specifically what I can do is take my Rett syndrome lens and think about, where is this child at? And what might be impeding them from that next little step to get towards that bigger milestone goal? So how can we break up the little pieces to the greater role? And so I can think about what these kids are, what's Rett specific basically needs they have, and how that Rett mind might work from a motor standpoint. And the last part is what's already been mentioned, is collaboration. We connect and collaborate with community providers that are local to you, that are in your home, that are going to get to know your child much better than we do. But we're going to kind of drop a little Rett specific information to help make those therapeutic times all the more efficient and specific to that child's needs. So thank you so much.
Great, I'm on. Hi. I want to repeat what everyone said. Thank you so much for joining all of us. For those of you I haven't met, I'm Susan Bessler. I'm a relatively new member of this wonderful team. I've been with Katie's clinic for about 1.5, 2 years now. So I've met some of you and I'm looking forward to meeting all of you eventually in person, and I can't wait. But I want to say, even though I'm relatively new to this clinic, I'm been a dietitian for, I don't even want to tell you, for about 30 years. And I'm really lucky because in my 20s, I realized the area that I really love working with is children, and particularly children that have, you know, unique healthcare challenges. And so 30 years later, I still love what I do and look forward to work. And so when my predecessor, Gail Sesh, who some of you probably met, went on and took kind of a more managerial role, I kind of jumped at the chance to join this clinic, and it's been wonderful. So my role is really identifying that your children are children, and first and foremost, or adults, but first and foremost, just identifying the life stage and what's needed and the growth that's needed and the specific age appropriate challenges. But specifically with Rett and associated syndromes, I work with Katie and with Dr. Tu, and we try to identify and address some of the nutrition challenges that we will see in our children and young adults with Rett and associated syndromes. So some of these include the GI motility issues, a lot of questions about poop, right? But you know, it is important, and it makes your child happy, it makes us happy. We talk about reflux, air swallowing, and you know how that affects their GI system. We work on chewing, swallowing difficulties, and solutions for that. First and foremost, I think I really am looking at growth. I want to make sure our little ones are growing and meeting their potential. And then some of our adults are kind of more interested in not growing so much, and what can we do, and how can we, you know, how can we support where they are, and how can we support a healthy diet and slow down the weight gain a little bit. For all of our girls and our boys, we are really attending to bone strength and bone mineralization. And so I'm going to ask you a lot of questions about calcium intake and supplements and things like that, and how best to meet those needs, because it's so important. But again, through all of this, I just want to stress is that we are really looking at nutrition guidance through the life cycle. And I also want to stress that it's a huge goal that food and feeding is a fun thing. A lot of people, they find out I'm a dietitian, they start apologizing. And those that know me know I have room in my heart for all food, the plant-based, the cheeseburgers and the pizza and everything. And I really want eating to be a joyful activity for your child and for your family. So thanks again. I look forward to meeting you.
Hi, Hi, everyone. My name's Judy Lariviere. For people who know me, who are out there, hi, everyone. I can't wait to see you back in person at clinic again. And for people who don't know me, I look forward to meeting you in the near future. So in terms of my role, and well, just even my background, I've been at Katie's clinic now for 12 years. So I guess I'm the second oldest team member, second to Marybeth. But that doesn't mean that's only length of time I've been involved in working with girls and individuals who have Rett syndrome. that started my journey, and my passion and interest in the girls started back in 1996 when my husband and I first moved to California. And I met, actually, everyone has their first girl that they meet who has Rett syndrome, and I was hooked. I could see all their communication potential just in their eyes. And it's like, okay, I want to help unlock that. And so I've definitely, people who know me, I am definitely very pro on the technology, as I see that as the way to really unlock the window to their soul in terms of, and have their personality shine through, because it's an independent means that they can use to communicate what's on their minds and in their heart. So my role in clinic, I see as I partner with parents to take their child's communication to the next level. And that's starting wherever they're at, because really communication is a journey. It starts wherever you're at, and then we move on. And so when I see you in clinic, I'm sort of checking in, and where are they at? You know, how is your son or daughter communicating currently? So that's sort of the baseline. And everyone, whether they're new or I'm seeing them as a follow-up, and as Paige was saying, the frequent flyers who I've luckily been able to see and grow over time, it's like, okay, so where are they at now, and where do we need to go next? So I'm always taking you to that next level, because I have the vision in terms of where the potential is and the possibilities are. And I want to take your son or daughter on that journey as well. So I'm always looking at the multiple ways he or she is currently communicating. And that's not, everyone's like, knows I'm definitely passionate and interested in the technology, but we don't always have access to that. So it's so important for me also to identify and help you recognize where and how they're communicating, just using natural gestures to communicate yes or no, because that's portable. That can be used anywhere and with anyone. We just have to identify what those signals are and get us to be able to read them and respond to them, because then actually communication does open up. And even though they may have a communication device in front of them, the girls are always, and individuals who have Rett syndrome or related disorders, always communicating in so many different ways. And so as part of my role in clinic as a communication specialist, I'm always looking at, okay, what are they using? And then bringing that to your attention. And I want to know also too, you know, where are they at? If they have a communication device, how's it going? Because I know it's not easy. And as I say, it's a journey. And sometimes I definitely hear parents say, yeah, I can't get them to use it at all. I've been hearing that a lot during this time where they've been at home, because individuals communicate naturally with parents in different ways. So it's not always through the communication device. So as I say, there's so many ways the kiddos communicate, and children, teens, and young adults. And so we want to build on what they're doing and then introduce other ways for them to communicate so they can really be independent in what they're expressing, because we are not mind readers, especially, I've learned that especially as I'm working with so many teens and young adults right now. So that's important for parents to know too. Even though they're like, yeah, I know what they're saying. It's like, yeah, but there's so much that is covered in communication. It's not just about making requests and, you know, communicating their needs and wants. There's expressing opinions, all of those type of things too. So the other thing is that I work to create a very rich communication experience for your son or daughter when they come to clinic. And that typically involves using technology, and I prepare for that ahead of time. I set that stage. And how I set that stage is through information that I get from your intake form. So it's so important that you have that information in there in terms of how they're communicating yes and no, how they are communicating when they're done with an activity or want more of something and indicate they're enjoying it, but also what's really their favorites, right? Like their favorite YouTube music videos, also a favorite book to read. And if you bring that to clinic, that's great too. But I need to know that ahead of time, because then I always give them a technology experience, whether it's on their device or the device that I have, so that we can really capture what is possible and give you a vision into that. And so to capture that also, I'm recording during the clinic experience so that you can take something home, or not take something home, I'll send it to you through DVD so that you can go back and review it, because there's a lot of times communication strategies and tools that I'm using that I want you to be able to carry over, and also show, obviously, your providers can't always be there, because once you go home, you've got other teams that you're dealing with, your speech therapist, your occupational therapist, your teachers. And so communication crosses over everyone. So that DVD is like a little treasure map, or a little to show what's possible. Then the other thing I do too is provide recommendations related to communication strategies and sort of talk with you about the next steps to enhance communication and take it to that next level, because I can't be there with you. And my goal is for you to be able to implement those things and teach others how to implement it, because parents are the best advocate and you are the experts in your son or daughter. So anything I teach you can then get transferred over to the people who you work with when you return home. So thank you. I can't wait to see everybody soon.
Thanks, Judy. So Katie, would you like to take this part about additional services, or Dr. Tu?
Yeah, I think Dr. Tu is going to do this one.
Great.
So sort of what was mentioned earlier, you know, if we identify specific needs or specific concerns during the visit with our team, we certainly have access to other consultants. So we are a great team. We think we're a strong team, and we are dedicated to helping your child and your family. But sometimes you need someone else, right? You need the GI specialist if you're having issues with feeding and nutrition. You know, a lot of our patients end up with G tubes and other ways to supplement their nutrition. So we have GI consultants available. We have orthopedics available. We know a lot of our patients end up with neuromuscular, you know, hip dysplasia or scoliosis, and there's a lot that can be done with the orthopedics evaluation that can really help the quality of life for your child. Then there's also genetics. You know, we want to make sure that every patient that comes through our doors has a full understanding of the underlying etiology for their symptom, for their syndrome, and genetics is a big part of that. And sometimes there are, you know, questions that persist, and it's really nice to be able to partner. We have a great pediatric geneticist that we have access to in Oakland, and we can certainly reach out to your home institutions as well if we think that would be helpful. And then importantly, cardiology. This is sort of the general health piece, again, similar to GI and orthopedics. We know that there are rhythm abnormalities and cardiac issues that can come up with Rett syndrome and related disorders. And so having access to a cardiologist is certainly important. The nice thing about being with UCSF and Oakland is that we have access to a lot of services. In addition to our consultants, we have access to getting that EKG, looking out for some of those cardiac concerns. We want to make sure that each of our patients get a yearly EKG, and that's something we have readily available in Oakland. If there are concerns about osteopenia and those hips that can be problematic and painful, we can get x-rays. If we need blood work, whether it's for genetics or some other general medical concern, we have a phenomenal lab that's just downstairs from our clinic space, and they have a lot of pediatric phlebotomists with excellent experience, making sure it's not a traumatic experience for your child. And then lastly, but importantly, when you come see us, it's a very long day, and we want to make sure that the whole family is taken care of. So right now during COVID, things are a little bit different. We have a cafeteria that is just across the street, easily accessible from the clinic space, that is providing free lunch to families during the lunch hour. Outside of COVID, we like to offer lunch for our patients and have sort of a gathering for all of our patients to, you know, meet other families going through similar experiences. And so we want to make sure that you're well fed and well cared for when you come to see us. And that's just a few of the things that we have access to. We certainly have a whole host of other referrals that are possible, depending on the specifics for your child and your family.
Yeah, and now I'd like Diane Matlock to join and talk a little bit about what some of those other services are and what she can do for you to help make an appointment and what that looks like for you when you come to clinic. Diane, so if you can unmute, we would love to see your face, because I know a lot of people hear your voice on the phone or get emails from you. So thanks for being
So hello, my name's Diane Matlock, and I like to refer to myself as the clinic person because I basically help you get connected with the department and make appointments. I work with families for referrals and insurance authorizations. Another thing I do is help get you gather all the materials and forms necessary for appointments. So you're going to be required to fill out an intake form that we will need a couple weeks before your appointment. So the clinicians can look through it and get to know your child before you come in and ask any further questions before you come in. You'll also need, we'll need to have a copy of your genetic testing results. And I'll need the name of your primary care physician and copies of your insurance cards, both back and front. Those are kind of just the nitty gritty things that we'll talk about when you call. And then I'll just talk to you about the clinic procedure, what your day is going to be like, what to expect during the day at Katie's clinic. And as Dr. Tu already said, we used to have great lunches up where you could all talk and meet. And unfortunately, we won't be able to do that until the hospital says it's safe for everybody to gather in a room together like that. But I can also answer general questions about UCSF, BCHO, which is our initials that took me a while to learn. I can connect you with the appropriate person to help you. So for example, if you're traveling from a far distance and you'd like to stay at the family house, which is a location located close to the hospital, and you can spend the night, I can help you get set up to do that, so you won't have to find a hotel, or I can help give you information about finding hotels in the area, those kind of things. And I'm here just to offer support and resources for you and your family and your child. For example, I don't know how many of you know about the Ed Roberts campus, or there's DREDF, which is the Disability Rights Education and Defense Fund, which runs like IEP training meetings and things like that. I know mostly about the Bay Area because that's where I'm from, but I'm really interested about finding out about other places on the west part of the United States. So I can always look into things and help you with that. So just kind of deal with the, assisting in the daily details of providing you in the clinic, which I have to say as an observer, they're amazing. My daughter is an unknown genetic syndrome and she's medically complicated. So although she doesn't have Rett, I know what it's like to be a parent with a child with special needs and who's medically complicated. And I have to tell you, since the time I've been at the clinic, I have learned so much from the team. It's been wonderful for that. And it also provides you with a community like the national and international Rett clinics do, of people that you can talk to. And I just have to say one personal thing too is Dr. Jones was my daughter's pediatrician when Isabel was still in the NICU. And she was the first doctor that ever made me feel that I could be a good mom for Isabel. And I know everyone's been talking in the aspect of what all they can do, and they can do amazing things for your child medically, just emotionally, physically, all the amazing things they do. But there's things that you're going to learn more about medicine than you ever thought you ever would in your life. But the most important thing that I can tell you as an administrative office person and fellow parent is that you can do this. You'll learn how to do this. And it's going to be an experience unlike you thought it would be, but it's going to be a really good experience. I mean, I can't believe my daughter's going to turn 13 this summer and how much I've learned. And so I just and that was something I learned from Mary and from everybody on this team, is that it's going to be a different parenting experience, but you're still going to be a great mom and dad and grandparent, or whoever you are in this child's life. You're going to be important, and you can do it, and you should feel positive about the process, and that we're here to help you. So those are the kind of things that I can help and support you with. And I can get you an appointment.
Bonus. Thank you, Jenn. All right, let's move on and talk a little bit about research.
All right. One thing quickly that I forgot to mention earlier when we're talking about all these clinic visits, this last year has really been an up and down roller coaster for us. We've been seeing all of our patients virtually via Zoom for the visits, but we're very excited that coming at the end of June, we're going to start seeing patients in person again. So we will now have full days of clinics with lots of families and lots of fun. So we're very excited to be able to offer in-person visits again. We still will have access to Zoom. We know that not everyone is readily jumping at the bit to come in person, and we totally understand that, but we're very excited to be able to offer it and offer it safely. Okay. So changing directions a little bit, part of this community is all about finding what works, but we also want to find what ends Rett, right? That's what we're focused on for research. We want to know what's going to help your child be better, what's going to help them improve their quality of life, and how can we move beyond Rett? What comes next, right? And so to that end, our clinic, as well as all the other centers of excellences around the country and the International Rett Syndrome Foundation, we're all very heavily dedicated to research. There's been some very exciting things that have happened, and we know that just beyond the horizon, there are more things coming. So a few of the ones that are active right now that I'll touch on, and before I get too detailed, again, we're focusing primarily on Rett, but we know that specifically FOXG1 has a very strong research community as well. And if your child does not have Rett, has one of the other related disorders, we certainly know about research there as well, and we can help you connect. But specifically about Rett today, the two, I would say, more pressing clinical trials going on right now, the first one being trofinetide. We're very excited about trofinetide because we actually, and in Oakland, under the purview of Dr. Jones, we actually participated in the phase 2 trial. So just to begin with, we want to say thank you to all those families that participated, because without you, we wouldn't be where we are today and we wouldn't be moving on to phase 3. So trofinetide is basically, it's a protein that comes off of the breakdown of insulin-like growth factor. We don't know exactly what this protein does, but we know that it's important for healthy brain development. It's important for inflammation in the mature brain, and it helps to decrease the stress basically that the brain sees. During these trials, it is a liquid that basically is taken twice a day. And for the first part of the trial, this is called Lavender. This is the double-blind portion where there's placebo and medication, and you are randomized to one of those arms. And it's a 12-week session where they're looking basically at safety and efficacy of this medication. After that phase is the Lilac phase, and this is where it's open label. So any participant that completed the Lavender phase can move on to Lilac if they choose. And if you move on to Lilac, you're actually given the drug. It's no longer placebo. So basically it's 40 weeks looking at the effects of this medication. And there's lots of endpoints they're looking at. There's lots of questionnaires and markers that they're studying, trying to look at the efficacy and helping to decrease disease burden and improve quality of life. We are not actively enrolling at Oakland, just with the clinic changes being a bit of a tumultuous year and the tragic loss of Dr. Jones, restructuring the clinic. We are gearing up and getting ready. We'll be ready for the next trial, but unfortunately we are not a part of trofinetide at UCSF, but very close by, UC Davis is enrolling, and UCSD is enrolling by invitation only. So if you have interest in this trial, we can certainly help get you in the right place. So trofinetide is one we're excited about, phase 3 trial. Another one that is further along as far as it's no longer enrolling right now. The study portion is still ongoing. This medication is Avonex 273. It's blarcamazine. It's a funny word to say. This medication is a muscarinic receptor. It works in the brain basically to decrease inflammation. It's got active trials right now, not only for Rett syndrome, but also for Alzheimer's and a couple other conditions, ALS, diseases where we know that there's inflammation and neuronal cell death that happens in the brain. Not specifically the exact pathway for Rett, but we know that the interesting thing is that this medication has also been shown to promote learning and growth. And so for our girls with Rett, that's primary the concern is both the oxidative stress and the inflammation and the idea that we're increasing learning potential. And so this trial right now is in phase 2. This is more looking at safety and efficacy before moving on to trial phase 3. This is looking at doses that are safe and potentially effective. It's also a double-blind placebo-controlled trial, so you're randomized into either getting medication or placebo. And Davis is another active site for this trial, but like I said, enrollment is over. Okay. And then another trial that's ongoing right now, it's basically a biobanking study. This is run out of UCSD San Diego. Basically what they're doing is collecting blood samples and a couple other potential, basically it's blood initially. I think there are some tissue options and CSF options as well, but they're looking at any biomarkers, trying to better understand Rett syndrome and some of the specific gene changes that we know. Can we correlate any findings or lab markers with those specific conditions? If you're interested in participating, we can certainly get you connected down at UC San Diego as well. And then coming soon, we're very excited. We know there's gene therapies coming. Novartis has been very active. They're very excited and we can't wait. We're very, very excited to potentially be one of the sites for these studies. That's what we're geared up for. That's what we're getting everything ready for in clinic, is so that we can be an active participant and help you guys down that journey as well. And then of course, the International Rett Syndrome Foundation has centers of excellence throughout the country. And as a part of that center of excellence, we are going to be engaged in the natural history study. So looking at Rett syndrome across the lifespan and really trying to understand as much about this disease as possible. All right, that's all I have for research. But like I said, we're very excited. And I hope you can tell just from me being very excited about this, we can't wait to see what happens.
Thanks, Dr. Tu.
Thanks, Dr. Tu. So now I get to have the fun slide of sort of talking about the accomplishments that our clinic accomplishments sort of outside of seeing our patients, which is obviously our main focus. But as it has been discussed, we were recently deemed a center of excellence by the International Rett Syndrome Foundation. We are truly, honored by this award and really proud to be included sort of in the list of clinics that are doing this fantastic work throughout the country. So I hope that all of you know about the Rett syndrome primary care guidelines. This is something that is very near and dear to my heart, as this was something that Dr. Mary and I sort of was our pet project, and we were so excited when it got published on the International Rett Syndrome Foundation website. We were so excited about that, and then just absolutely thrilled when the team led by Dr. Tim Banky and Dr. Carrie Fu really sort of worked tirelessly to get this published last summer. So if anyone hasn't seen these, I highly recommend you jump on the IRSF website and download them. They're just an incredible tool for your family and truly for all of your providers. There is not a specialty that it does not highlight. And the other thing that one of our team members, the one and only Judy Lariviere, contributed to is the communication guidelines. Again, we just know how that can be such a focus, and it's an incredible tool, again, not only for your family, but to provide to your home speech therapist. And these can be ordered sort of through the IRSF Foundation website. And then a couple of years ago, we had a fantastic Ed Day at Camp Arroyo. That's this sort of beautiful picture on the left-hand side in Livermore, California. We had girls in the pool. We had pool therapy. We got to get our kids on horses. And then we sort of had a day-long presentation of speakers ranging from, Dr. Jones to a genetic researcher from UC Davis, just sort of discussing the most up-to-date ways to take care of our kids. and the future research going forward. So we really hope that we can do that again in the summer of 2022, which seems far away, but we'll be here before we know it. So stay tuned for that. And one thing that I didn't sort of put on the slide, but is important, and I think a big piece of our clinic is we really include a lot of medical students, whether that be medical students, nursing students. We try and really educate as many people in their training as possible on Rett syndrome, and it's been a big piece of sort of, spreading that knowledge around. So and then next slide, Paige. And I just want to do a huge thank you first to the Katie Nues Foundation, who generously supports our clinic. We just couldn't do our work without them. And to everyone who fundraises and volunteers for our clinic, we are just so grateful for you. And certainly, first and foremost, our wonderful families. You are why we do this work, and it's a true privilege to work with you and to take care of your children. And we're really looking forward to seeing everybody in person soon.
Thank you, Katie, and thanks to everyone for such wonderful descriptions of the work that you do at the clinic. It's that you were just skimming the surface of the things that you deliver for families, both on a clinic day, but also outside of clinic. As we say, it's a clinic without walls. Providers come in from all the different disciplines on the day of clinic, but you stay in contact and support families in the community, in school, adult programs, and we're just so grateful for you. And as you described the last couple of slides, the philosophy of our clinic is the enriched environment, and our Ed Day that we had at Camp Arroyo really was a living example of the enriched environment. We had, Judy had technology corners going where people are coming and trying different devices, and siblings were out getting to know each other because it takes a whole family. Everyone in the family is affected by Rett syndrome. And so siblings had a chance to get to know each other and do things like ropes courses and zip lines, and our kids with Rett syndrome who are up for it even got on the zip line. So darn COVID, but yes, I think that we will be able to do this again in 2022. And it really goes to show that, we don't just think of your kids as patients. They're kids, they're adults, and you are families, your parents and grandparents and aunts and uncles and siblings, and you're there for each other. And we are always looking for opportunities to bring you all together. So I think that is the true spirit of the clinic, and it starts with each and every one of you. And Diane, thank you. That was a beautiful sharing that you did for what you personally get out of clinic, and I think it shows when you talk to families. So thanks to everyone for what you do with your heart. Now, if you'll stick with us for a few minutes, I'd like to share some kind of national/international updates in the world of Rett syndrome for those of you who haven't heard any of the latest and greatest from our foundation, and then we'll go to QA. Okay, so bear with me for a couple of slides. So I'm the Director of Family Empowerment for the International Rett Syndrome Foundation. I have a daughter with Rett syndrome who's the namesake of the clinic, so I kind of get a really special insight into a lot of things and a lot of aspects of this journey. It's very personal for myself and for our family. The mission of our foundation is to create a world without Rett syndrome. We're focused on that end goal, as Dr. Tu said, the entire clinic and the entire network of centers of excellence in the US and around the world work collaboratively towards that end. And for nearly 40 years, we have fueled life-changing advancements in discovering the gene that causes Rett syndrome, and that's allowed us to now turn our focus towards a cure, and we're relentless in that pursuit. So while we do that, we also believe that we have to help families thrive today. know what resources are available to you, what legal rights and you have in the US, how to advocate for your child, how we as a foundation can advocate for you and your family and to empower you. We know that Rett doesn't stop and neither do we. So we are really very excited. The last time that we had a National Family Conference was in 2016, and we had to postpone because of COVID, but Ascend, the Rett Syndrome National Summit, will happen. Well, I mean, I can't, no crystal ball, things could happen, but we have a contract signed and we will be opening registration for the summit April 27th through 30th in 2022. We hope each and every one of you will travel to Nashville. It's a great city. We will be at the Gaylord Hotel, which is like a city in and of itself with lots of activities on site. We will have Rett expert scientists, clinicians, the centers of excellence. You'll get a chance to meet other families who have a child your age or might have the same mutation, or you know, we'll have opportunities for grandparents to meet, lots of social downtime. Some of the best learnings we learn from each other when we look at each other and say, oh, where'd you get that chair? Or how do you get her to use her hands like that? You know, it's building a community and sharing the wisdom, and to spend a couple days together, there's just nothing that can replace that experience. And I think especially now we're all craving time being together. So look for that information on our website, rettsyndrome.org, and we hope to see you there. This last year, we launched on our website a tool to help you understand all of the research that's available for you to participate in. It's the Rett Research Ready program. If you go to rettsyndrome.org, you can log on and you can learn everything there is to know about a clinical trial, what it means for you to consent to have your child involved in a trial, what it means to drop out of a trial, why it's important that you stay in a trial. You'll also learn about other studies that are available that your child could participate in that are observational or are virtual, and there are some of those that are available. And surveys, we have surveys that professionals, graduate students, PhD candidates, fellows, you know, I wish I could say we knew everything there is to know about Rett syndrome, but we're still learning each and every day. And if we as families don't meet our researchers where they are and where they need us to be, that progress that we all crave won't happen. So we came up with this tool, which will help you find out very quickly and easily what you are eligible to participate in, given your child's age, diagnosis, where you live, how far you're willing to travel, you know, put in some things like that. And then you can get push notifications and alerts. There are currently 3 studies that you can participate in. And if you just take a picture of this QR code, it'll take you to these 3 studies, and they are seeking participation. So take some time to learn more about that. And Katie mentioned the communication guidelines. We were happy to publish those this last year. That is the result of a 6-year research grant where we had over 600 professionals and families worldwide contribute to best practices regarding communication with Rett syndrome. It's got guiding principles, strategies for optimizing engagement, how to do an assessment, how to do an AAC assessment, different than a general communication assessment. How to get an assessment for device, interventions, so much more. It's only $10. You can get it in print, you can get it in a digital version, and it's also available in Spanish. And I think that it should be just something that you buy multiple copies for. Give it to your child's teacher, give one to your child's therapist. If you have a nursing assistant or a caregiver working in your home, let them, because communication is just so fundamental to an enriched in life for your child, and it is possible, but it's not intuitive. So this guideline in the book is available to you. Judy, thank you for contributing to the development of that. We have a lot more to share about research. Dr. Tu, thanks for sharing what you talked about that Oakland specifically has been involved with, but there are a lot more studies, and our 2 upcoming Rett Rett Ed webcasts are focused on research where you will learn a lot more. So next week, Tuesday, June 15th, you can register for this webcast with Dr. Dominique Pichard, who's our Chief Science Officer, and she's going to talk more in depth about bringing treatments and cures home to our families. And on July 28th, we are very lucky to have PJ Brooks, who's the Program Director for the Office of Rare Disease Research and the National Center for Advancing Translational Science at the NIH, join us to talk about gene therapy. That is his passion and it's his background, and he's going to talk about literally what gene therapy means, because it's not a single definition and there's not a single answer to it. So he's going to help break it down for us. And then we have the Chief Science Officer from Cure SMA, who is going to come and talk to us from a community perspective, from a community who has received gene therapy, and talk about what it was like for those families to enroll and participate and what has come after. So I think those are two Rett Eds that I highly encourage everybody to register for. Okay, and again, QR codes can take you there, or just go to rettsyndrome.org and you can look for the links to sign up for those. And I would like to make a special announcement and a plea and an encouragement for everyone who's local here in the East Bay area to come out for Samantha Corpus's golf tournament, which will be on July 13th at the Black Hawk Country Club in Danville. The Corpus family has been holding this golf tournament for 15 years, and they're calling this their Farewell 15, not because anything has happened to Samantha, but they are just tired. And so this is their last and final tournament. So if you're a golfer, get a foursome together. They're filling up quickly. It's a great day on the course. And if you're not a golfer, you can sign up and join for the dinner and auction, which is a nice early night because the golf stuff ends around 4 o'clock and dinner is around 5. And we would appreciate you coming out to thank John and Kathy for all the work that they've done for this tournament, as well as to participate in an in-person event. We'll be in person, it'll be outdoor. And it will be just a fantastic event. If you can't be there, but you can donate an auction item or donate some time, or just spread awareness to some other golfers that you may know, please, let's help him go out with a bang. He has set a very high bar for what he wants to go out with. And the funds raised from this tournament go to IRSF. But as we all know, IRSF also financially supports Katie's clinic. So John and Kathy, if you're on the webcast, I applaud you for having the time to be here with us tonight, because I know that you are frantically putting together this tournament, but good luck. All right, so let's talk a little bit about resources for you as a family. You know, our mission is to accelerate research and empower families. Here's a picture of my family getting Katie out on the slopes. And it was just a really special day for us and for Katie's sisters and for my husband and myself to get out to achieve Tahoe and see her go up on a lift that was specially designed for somebody in a wheelchair to be out on the slopes, and have someone take her down the hill and feel the cold in her face and feel what it was like to accelerate down a hill. And she was just on top of the world for the day. And I wanted to share that picture because there was something that took a long time for me as a parent, even though I tell parents and families all the time, get out there, experience the world. Katie's particular biggest challenge is seizures, which we just haven't got well controlled. And so we've allowed that to really limit our willingness to take vacations and get out and do stuff, because it just, as soon as we book something, that those seizures crop up, and they sure enough did that day. But you know what? We let her have her seizures. She rested. We got out on the slopes for half an hour, and that half hour will live in our memories forever. And we had that experience, and Judy helped us get that story onto her Toby, and I cannot get her to stop talking about that day. She will, no matter where we hide it on her Toby, she will find it, she will talk about it, she will tell people about it. And so I know how meaningful it was for her. Even if it took us 3 days of effort to have 30 minutes of fun, it was worth it. So I encourage you as families to find out all of the things that are available in California that are adapted and available for you and your family to do. And that's part of building community, is talking to other families, whether it's on the social media forums, through meeting each other at the lunches at the Rett Clinic. You know, let's take advantage, get out and do stuff. Your life will be better for it. And I think your child will surprise you at how much he or she will enjoy doing those things. As Diane said, you just have to kind of, you know, readjust your expectations and then let it fly, and good things will happen. The other piece of advice I'd love to give you is to let the community know you. Let the community in and let them know your child. Get her out, get him out, let people ask questions. I know it's hard when you get the stares, when you get children who may, or adults who may ask questions maybe in a way that doesn't feel so sensitive, but try to take the high road, try to explain. The more people that know your child and know about you and your family, the more you'll find that you're accepted and you have a place, and they should have a place. So let your community in, and good things will happen. Teach others how to communicate with your child. It's a big piece of advice that I have. Make an all about me book that kind of documents pictures of your child having a good day, your child having a not so good day, what they really like, what gets them to wake up, what gets them excited, and share that book at your IEPs, when you go to early intervention, when you go to preschool, kindergarten, elementary school. Share that book with caregivers who come into your home. And let me tell you, there are wonderful caregivers that you can find who can come in your home and learn about your child so that you can get a break. So don't think that, I know, especially for newly diagnosed families, it's really hard to imagine that anyone would be able to take care of your child as well as you could. And you know what? They can't, but they'll probably do some things with your child that you're not willing to take that risk. And that's a good learning experience too. And I'll say that from the grandparents who took my child on the teacups at an amusement park, which I would never have taken my low tone child with reflux on teacups. And they did. And you know what? She loved it. So sorry that I'm sharing all of these stories, but I just want to share them as ways to say, you know, open up, experience life, and talk to other families. Because when you see other families succeeding, then, you know, it gives you the confidence that maybe you can too. One of the resources we have on rettsyndrome.org is state by state, a list of resources that are available. So Diane talked about DREDF. Many of you are new to a lot of the agencies that are there to support you. And I know you never thought that you would have to take advantage of federal or state agencies. They're complicated, they're bureaucratic, but they will help you. CCS, California Children's Services, is there for you and possible for therapies for many of your children. Regional Center, great resource for getting funding and support for your child. Your case managers should be getting you the paperwork for institutional deeming and for helping with that transition to adulthood, and for conservatorship and guardianship as they reach adulthood. They're getting paid, it's their job to help you with these things. So take advantage of them. And if you are not familiar with any of these agencies, you can reach out to me. Diane is very familiar, she's dialed in, but take a look at the California resources. And I know that we also have families who are on today from other states in California. We have all states in the country have this specific webpage. So those are just a few things about additional resources that I wanted to share for you that we're continuously updating. And most of the information is community provided. So if you know of a park, if you know of an advocate, if you know of a service that is not listed on any of those web pages, but you have vetted them and you feel really good about recommending them, let us know and we'll get them up on that website so that other families can take advantage, right? Because we learn from each other. All right, so I am going to stop sharing slides because we need some time to interact. Before we go to QA and chat, I'm going to try to do a quick poll if I can. This is a new feature. So, okay, so I have a couple questions that I would like you to answer. So everybody, if you've been wandering around or you're in the middle of dinner, if you can get to your clickable device, whether it's your mouse or your phone or your keypad, and we'd like to hear a little bit from you about it's very small font. Again, I'm very excited to be moving to a new webinar platform, and Zoom offers this polling feature. So if you would do me the honor of please taking my poll so I can test this out with you. We'll just give you a little bit of time. I'm not sure if you can see all the answers or if I'll have to share. No, okay, it's just coming in, and then after you answer, there are just a few, 5 or 6 questions. We're really curious. This is a little bit of you grading us on how well we did with the town hall, but it's also letting me test out a cool feature that we have. Okay, let us go for about 20 more seconds and then I'll close the polling and we'll move to QA. Okay, thanks. Would y'all like to see the results? All right. Sharing poll results. Can you see them? Okay, so look at that. 70% of our attendees have been to clinic, 30% have not. Probably should have asked that at the beginning. Have a really nice spectrum of ages. We have some nice adults, a lot of adults on. Okay, would you like to have Ed Day at Camp Arroyo? 50% said yes, and 40% said you need to know more. And for those of you who don't want to, there's no requirement. You don't have to come. All right. A lot of you are not active on social media platforms, so I'm really glad that we held this town hall, because I think we make an assumption that everybody's on social media these days and are getting access to a lot of information. So this is actually very informative to us, I think, as practitioners, and we will think about ways to continue to get information out to you if you're not on social media. And then I put a question out if you'd like to do any volunteering with the clinic or with IRSF. And thank you to those who have said yes, you're unsure. My email address is pnues@rettsyndrome.org. Reach out to me and we'll talk, or get in contact with Diane. And then I was just really curious how you all felt about telehealth appointments. I think this is really important. We're having to do a lot of advocacy to see if payers are going to continue to reimburse for telehealth appointments. And so for Dr. Tu and others who are in those meetings, this is important to know that a lot of you prefer telehealth when possible. Some of you really prefer in person always. And depending on I think I fall in that last quick category. It really depends on the issue, right? For some, I would really prefer not to have to drive into the city and park for a consult that we can do through webcam, but sometimes I really want you guys to put your hands on my kid and help me figure out. So, all right, thanks for answering that poll. So I'm going to stop sharing results and we are going to close that out, and let's go to QA. So I don't have any questions showing in the queue, in the question queue. So if you have any questions, please go ahead and type them into the QA now. I do see a question in the chat about Neurin. Okay, so let me read this one out loud. So Neurin has been guarded about the specific results in their public documents, and when asked, they're not willing to share any details. So why would a parent feel good about enrolling their child in this trial? That's a really good question, and you will hear more about that on Tuesday in the Tuesday Rett Ed. But Dr. Tu, I would love for you to answer about why pharmaceutical companies cannot disclose data.
So yes, it's a little bit of a challenging, sort of confusing situation. The pharmaceutical company itself will not share that information. They typically don't publish their data for 10 to 15 years after a trial is done. So the pharmaceutical itself is not going to share, but there is published data from the phase 2 trial that shows safety and shows improvement in quality of life. You can find that published data. And also you can go to clinicaltrials.gov, and that site right there tells you what all the endpoints are, what they're actually measuring in these trials. And for this trial specifically, what they're looking at are some behavioral questionnaires. They're looking at some Rett specific and validated scales and assessments for quality of life and communication, things like that. And so based on what the endpoints are, we can gauge that the positive, statistically significant results are showing improvement in those scales. If you're concerned about side effects or potential adverse effects, those are also published. Those are a part of the clinicaltrials.gov reporting, and you can also find that in the published data on PubMed that's available from the specific individual institutions that were a part of the phase 2 trial.
Thank you. And would you consider it safe to say that the FDA would not have approved progression to a phase 3 if there was not enough data to indicate that it was worth moving to phase 3, or if there were any unsafe or adverse effects?
It's a great question, Paige. Definitely the phase 1 and phase 2 portions of these studies, which don't get as much press as the phase 3 trials do, is really what assures the safety. It identifies the range of dosing that's necessary, and it looks for all potential side effects at those dosing ranges. And so to have gotten to phase 3 trial with the approval of the FDA indicates that it's a safe medication. But the important thing to assure families is that they're always evaluating the data. And anytime a patient has a reaction or an adverse event during these trials, they run statistical analyses nonstop, making sure it's safe to continue. So when a trial is conducted in this manner, especially when it's gotten to this phase, we feel comfortable saying it's safe, but again, everyone's a unique individual, and there's always going to be potential for reactions in individuals. We're looking at statistics as a whole, as a group, and so applying that to the individual is always challenging. But as a whole, I would say this is a safe trial. We've got good evidence from the phase 2 portion that there's statistical significance and improvement in those behavioral markers. And so that's part of the reason why we're excited about this trial being in phase 3.
And I just want to speak a little bit because I have been communicating with the UC Davis team because a lot of, just working with them because Dr. Jones was sort of a part of that prior to her passing away. And I have been really impressed with their team and I trust their team. And so I've been happy with how they've managed things so far. Obviously, I'm not directly involved in the trial, but I just wanted to give my feedback on that.
Thank you. Yeah, and it's Dr. Rondi Hagerman, who is the lead PI for that trial, and she's a very good friend, and I've known her for a long time, and I know she was just so excited to be the PI for this trial, and my feedback from families have been that they've had a wonderful experience with her and her team. So, okay, we've got a couple of questions that have come in the queue, and we have a few minutes left. So,
I have one answer for one of them. The person who asked about hippotherapy in the South Bay, there's a place called Mains for Movement. Mains for Movement. So just throw that out there as one of the names that I found on the list of hippotherapy.
Fantastic. Can you type that in?
Oh yeah, sorry. Sorry about the technical stuff. Sure.
That's okay. That's just in case other people want to know. So the question was, are there aqua therapies or hippotherapy in the South Bay? So thank you, Diane. And if you're hesitant to be on social media, I will say that you can be on social media as a stalker. You do not have to be active. You can create a profile for yourself on Facebook and not use it for any other purpose other than joining something like the California Rett Syndrome Families Facebook page, where you can ask questions just like this. So families that literally live in the South Bay could have a chance to weigh in and answer. So we'll put that question out there because I don't know about aqua therapy in the South Bay. I don't know the answer to that. All right, another question we have is from a family who has a 37-year-old daughter who's got lack of mobility issues because of dislocations and contractures, and they need more information. I'm going to take a stab. We can't talk about specific families, individual care, but it sounds like maybe a visit to the clinic would be worthwhile. They are an adult. Dr. Tu, can you talk about how we manage issues with adulthood?
So there are some specifics that need to happen depending on whether your child is CCS, private insurance, or as an adult has transitioned to Medi-Cal or similar services. So there is an authorization process, but we don't really deny anybody to come to our clinic, right? And so for questions like this, it really sounds like a good physical therapy evaluation with recommendations for basically durable medical equipment or things that can improve mobility. And that's a great reason to come see us for a tone assessment, potentially a physiatry assessment with rehab, and then a specific physical therapy assessment.
I'm muted. And for the older child, for communication, Toby, augmentative assessment, would a visit at clinic be helpful? Judy.
Yeah, so the question was, from what I can see, is how can we find out to get help with our Toby? So it sounds like your daughter already has a Toby, so definitely I always help individuals who have a Toby already. So I always have them bring the Toby to the clinic. And that can be actually, I'm talking about in person, but that can also be handled remotely too, because there's ways that I can, obviously through telehealth, you can show me what's on the Toby, but I can also share a link to program that you can download onto the Toby, and I can remote in at the time, of course, when you're there, and I can see exactly what you have set up on there really easily. Also check calibration, all sorts of things in terms of settings too, because sometimes that can sort of prevent or support your daughter's use of the Toby. And also when a young woman is using a Toby, sometimes they get stuck in certain locations on the device. So it's all about access too. So I'd be looking at sort of like, okay, are we stuck in a certain location? And so that might be preventing her from using other areas of the screen, or maybe she just needs a refresh with new content. Paige did a beautiful job talking about how some of Katie's life experiences I had programmed in terms of her memories and things like that. And she can go back and not just give information about them, but interact with people around them as well. So definitely a clinic visit, either telehealth or in person can work.
If I could just jump in again for one thing that I really noticed that all the providers said that were really good about the telehealth appointments, where they were able to see the children in their home with the equipment that they use on a day-to-day basis. And I was reminded by what Judy was saying, because she saw a child who's the way the chair that she was in was always making her head turn a certain way. And so she's always saying one word over and over again. And she would not have known, Judy would not have known that if she hadn't seen that through a telehealth appointment. So I think that was one of the things that the team did really well with the telehealth visits, was seeing things and seeing the children in new ways.
Yeah, good one. Okay, we have a question about, we're waiting on blood work to hear if my daughter is accepted. If so, are you guys notified, or should I reach out to the clinic? I'm asking if that's, I think that's specifically about enrolling in the clinical trial, but I'm not sure. So if you can answer.
I mean, if it's related to clinic, it could be related to clinic, because we do sort of ask for genetic reporting sort of prior to coming to clinic, just because it gives us a better idea about what to expect clinically. That doesn't necessarily mean that if you don't have a definitive genetic diagnosis, but there is suspicion of Rett and Rett-like disorders, that we won't see you. We sort of manage that on a case-by-case basis. So, this is also just like this is probably just generally for medical health systems. If you have a provider that said, hey, we're going to do this genetic testing, if this comes back, definitive for Rett syndrome, then I will refer you to the Rett syndrome clinic. Then certainly you don't need to reach out to us. But one of the things I always sort of just stress with my families is that it's always okay for you to make the call. Just, relying, unfortunately, with our healthcare system, everyone's very busy. So, it's never a problem for you to call us and say, hey, we got this blood work. Have you heard from anybody yet? And then, we can sort of make that process happen sooner. So, just sort of in general, I can't really speak to the clinical trial because I don't know what the protocol is. I don't know if Paige, you could, but hopefully it's helpful in the clinic standpoint.
Yeah, so that's a good answer, Katie, for clinical, for the clinic, if there's blood work. The parent had the time to answer, to say yes, it is specifically in response to enrolling in phase 3. So yes, I would call UC Davis. Katie's clinic would not be informed of anything related to that trial. Okay. And if they don't get back to you, you can let me know as IRSF, and I can see if I can bridge any communication breakdowns. Okay, last question in the queue is, does the new Alzheimer medication help Rett syndrome symptoms?
Is this in reference to the Aduhelm new medication? I'm assuming, because it's gotten all the press lately. If so, the answer is no. It's a different mechanism for treatment, so we don't expect it to help with the Rett syndrome specifically. But this is a unique medication in the way that it works, and so offshoots from this may arise. But in initial development of this medication, they did look at other potential indications. They looked at Parkinson's, they looked at progressive supranuclear palsy and a couple other of the dementia disorders. And so it's been funneled specifically for Alzheimer's just based on that preclinical data. So no, we don't have any reason to suspect that it would be helpful with Rett, but again, offshoots and related compounds may come down the pipeline based on the results from this medication. I hope that's the one they're referring to. But.
I would assume so. Didn't specify, but yeah, that's the one that's in the news. So kind of sorry to hear that, but thank you for the honest answer. Okay, we're getting at the end of the hour and a half that we promised to be together. I want to ask this question because I'm surprised it wasn't asked, and maybe it is just because the time has passed and it's not a question for anyone anymore. But Up till now, we've been getting a lot of questions from families about getting the vaccine. And is it safe for our kids? Do you recommend it? Eligible now for children 12 and up. And have you seen side effects? What's your closing advice? Let's close out on that topic, if I may.
My closing advice is absolutely, we recommend it for not only all eligible patients, but certainly caregivers too, anybody who's caring for our kids. We know that there is not necessarily an immune component or deficiency or problem with Rett syndrome, but we do see, you know, kids who get pneumonia and are in the hospital, and you know, we want to really prevent that. You know, I think that we should be, and Jen, sort of correct me if I'm wrong, because this information is fairly new, but I do think that we're potentially going to even be able to offer it at our clinic if people, so that will be available. But I always also just direct people to the IRSF website that sort of has the statement on the sort of international communities, all the medical advisory board, their opinion on the vaccine, which we are in agreement with.
Okay, thank you. It's the first town hall where that question hasn't come up, so I just had to throw it out there. All right, well, we are, let's see, I think there are no more questions in the queue, and oh, someone did say, I have a question. My daughter got her first dose. I'm concerned with the side effects with teens' inflammation of the heart. How can we monitor that?
So the data we have, cardiomyopathy is a known potential side effect, rare complication, and I will stress that rare complication, seen more often after the second dose of the vaccine, not after the first. Generally, part of the reason why we want all of our girls to get EKGs and just sort of general routine care. Myocarditis is not typically something that is that doesn't come to the attention. Your child will be acting differently. So really, you're just looking for any indication that your child's not feeling well. Okay, but again, it's a rare complication and noted more often after the second dose of the vaccine.
And more often in boys. Also in adolescent boys versus adolescent girls.
Yes, thank you,
so that's
Katie.
another thing, what we have found, yes.
Okay, thank you. Well, I think this has been a really successful town hall, everybody. Thanks for staying with us through dinner time, and thanks for joining us. And this is not a one and done. We are available to you all at all times. So as a foundation, we're here to support you. Let us know future topics that you'd like to see for Rett Eds. We felt like this town hall was timely and important. And obviously you did too, because we had great turnout. Thanks to all the providers. We are just indebted to you. We, as a parent, I can say I didn't have a choice in joining this life with Rett syndrome, but you certainly did. And we are grateful for you and your efforts each and every day. So thank you so much. Good luck reopening. I know it has been a heck of a year for you as healthcare providers, and with all of the change that we experienced at clinic. I'm so excited you're going to be in person in June. And I think we're turning a corner. So let's keep onward and upward, everybody. Be well. I hope that your therapies start to be in person again. I think CCS is starting to doing some in-person appointments again, and that will be a good thing. And if you are sending your child to ESY, I hope that is successful. And I hope you have a good summer. If not, I hope you can take some time to have a good vacation. And hopefully we'll see you all next week, Tuesday, for the Rett Ed, to hear more about what's going on in the world of science. And I can't wait to see all of your beautiful faces at clinic. Until then, be well, have a good evening, and take care.
Thank you, everyone.